In February 21, you claim that the VA has saved millions of dollars by firing staff. How much have you saved? You said millions. What's the amount?
Those millions in the round amount I'd have to get back, especially now with those who've come back, there's probably a different number that I'd have to get back with you on.
Aren't you prepared to give us that information, knowing that you are testifying, knowing that you will probably be asked for factual information such as this? So you don't know, even if you said in February that you saved millions of dollars by firing staff. And then you said,
Well, let me clarify
let me finish my question,
we did say
please.
14 million when we did away with our DEI.
You say $14 million?
Yeah.
Okay, so then my next question is, where is all that money going? I have a series of questions relating to your comments on February 21st.
Think about this. Veterans' clinical trials put on pause, staff fired and rehired after lawsuits, and millions supposedly saved, yet no one can give a straight answer. Where is all that money going?
So you said millions of dollars, now you're testifying. First you said you would have to get back to me, but now you're saying 14 million. Also, by cutting unnecessary programs, can you tell me what unnecessary programs specifically you have cut? And then you've redirected those savings, some 14 million, you say today, to veterans. And I would like to know specifically where these monies were redirected. Do you have that information
The
today?
number that I gave you just now on the DEI was the 14 million. Those have been directed to those with disabilities and prosthetics. We've also had a part of that millions was also contracts that were either terminated or renegotiated that we were in the process of doing
I think you need to tell
as
us
well.
exactly what contracts have been terminated, because that's the thing about a contract, you know? When you terminate it, you have to have a reason for that, otherwise you end up having to pay.
Senator,
So,
also in the contracts, you also have to, when you're going through contracts and renegotiation, you also have to make sure that you're doing it properly. We're going to give you all the information you need when those are actually finished.
I would hope that you would have had all that specific information today. You have about 500,000 employees at the VA?
I'm sorry, I didn't hear
Does
you.
that sound right? You have 500,000 employees at the VA?
No, we do not.
What is some number of?
About 470.
Okay, that's getting pretty close to 500,000.
Yeah,
So,
it's a little high.
and what categories are they employed? I mean, for example, how many nurses, how many doctors? Do you have this 470,000 employees broken down by categories of jobs?
Well, that is part of our problem, Senator. I laid that out in my opening statement and also in my conversation with.
But you don't know.
No, and
You don't have that.
let me say
You don't
something.
have that information.
Let me say something. Yes, we have over 300,000, probably closer to 400,000 position titles. But you know what the problem is?
Thank you. That
Before
would
I
help.
ever got there, we couldn't even find some of these when our HR people started to look at. So we took what we
Okay,
had at
let
that
me-
point.
let me proceed.
Well, I just want you, if you want a direct answer, then I'm giving you a direct answer.
You have a lot of people who are working for you. I would like to know, because there are questions about
Well,
who
and I'm
are you
trying to answer your
actually
question.
going to let go when you get to the 2019 numbers that is your goal. So you were asked some questions about the clinical trials. That's very important to provide healthcare services to our veterans when they are enrolled in clinical trials. Do you know how many clinical trials are on pause? And do you know how many veterans are in clinical trials?
I'd have to get that number back to you.
Is it 10? Is it more than, are we talking about 1,000 clinical
No,
trials?
we're not
When you
talking about, but again, here's the question.
Can you give me a ballpark figure on?
No, I'm not going to ballpark because it'll be
Okay,
used
so you
against me
don't
next
know.
time I'm
You
here.
don't know how many people that you have put on pause so that they are not getting the healthcare services that they need, because that's what a clinical trial is. You are getting medication, you are seeing doctors, you put these trials on pause. You cannot tell me how many veterans are now being paused in their clinical trials. You cannot tell me how many veterans are enrolled in clinical trials. You also cannot tell me how many clinical trials impact you have over 9 million veterans that you are taking care of. Clinical trials are very important, and you said so yourself. Mr. Chairman, I have other questions. It's very clear that our secretary has not come with much in the way of numbers, and I really don't know how he's going to go about getting to 2019 figures for cutting employees, and he can't tell us what the categories of employees are, et cetera, et cetera. So I think we're going to need to hear from Mr. Secretary again. Mr. Secretary, would you commit to coming back to this committee to provide us the kind of information we are asking for and to respond to questions?
I will get you the information that you asked for, which is
Will
what we've
you,
been doing.
will you come back to testify, or is this it for us with you?
I will
Mr.
get you the information
Secretary?
that you're looking for, Senator.
Mr. Chairman, we're not getting any commitment from the Secretary that he will come back to this committee to provide us the responses to our questions. Thank you.
Senator,
That
tell
says a
us-
lot.
What we're seeing here is more than just a tense back and forth in a Senate hearing. It's a window into how money, accountability, and political agendas collide inside one of the most important agencies in America, the Department of Veterans Affairs. And the question that Senator Mazie Hirono hammered home, where is all that money going, should be the same question every taxpayer is asking. Because, let's be clear, the VA is massive. It employs nearly 500,000 people and serves over 9 million veterans across the country. It manages hospitals, clinics, research, disability programs, and mental health services. It is, in essence, the second largest government agency after the Department of Defense. And yet, when lawmakers ask the Secretary for specifics, how many employees were cut, how much money was really saved, how many veterans' clinical trials were put on pause, we get vague answers, shifting numbers, and promises to get back to you. That's not accountability, that's evasion. Now, here's the deeper issue. In February, the VA bragged about saving millions by eliminating so-called unnecessary programs, including diversity, equity, and inclusion initiatives. Today, under pressure, the Secretary gave a more specific figure, $14 million. But when asked to trace that money, where it went, what programs it was redirected to, which contracts were canceled, he couldn't provide clear documentation. Think about that. This isn't pocket change. This is taxpayer money, money that could mean the difference between life and death for veterans relying on prosthetics, cancer research, or mental health care. And we're being told, trust us, we'll get back to you. This is not a new story. For decades, the VA has been plagued by inefficiency, bureaucracy, and underfunding. Scandals have erupted over long wait times, poor care, and veterans literally dying while waiting for appointments. Politicians love to say, support the troops, but when it comes time to actually fund that support in practical, measurable ways, we get cost-cutting slogans instead of real solutions. What Senator Hirono exposed is the shell game at work. Cut staff, boast about saving millions, only to be forced by the courts to rehire those same employees because the firings weren't done legally. Fire people without following due process, and suddenly the savings disappear. But the disruption to care is real, and veterans are the ones who suffer. And let's talk about the clinical trials, because this is where the human cost becomes undeniable. Clinical trials aren't abstract programs. They're veterans with cancer testing new treatments, veterans with PTSD participating in experimental therapies, veterans receiving medications that could extend or save their lives. To put those trials on hold without being able to say how many veterans are impacted isn't just sloppy management, it's reckless. Imagine being a veteran who has already risked everything in service to this country, only to be told the care you were promised is being paused for reasons no one can clearly explain. This is about priorities. The same politicians who cry fiscal responsibility when cutting DEI programs or veteran staffing never hesitate to approve billions for tax cuts for the wealthy or subsidies for defense contractors. But when it comes to investing in the well-being of the very people who wore the uniform, suddenly the math gets fuzzy, the records go missing, and oversight collapses. And here's the bottom line. Transparency is not optional. If you say you saved $14 million, you should be able to show exactly where it came from and exactly where it went. If you say you cut contracts, you should be able to name them. If you say you paused clinical trials, you should know how many veterans were affected. Anything less is not just incompetence, it's a betrayal of public trust. That's why hearings like this matter. They cut through the talking points and force officials to answer tough questions. But it shouldn't stop there. We, the public, need to demand more. Veterans' lives and health are not bargaining chips in a political debate. They are obligations, promises this country made and must keep. So here's the call to action. Don't just listen to the slogans about supporting veterans. Watch closely, ask hard questions, and hold leaders accountable. Because if we don't, billions will keep disappearing into vague savings while the men and women who served are left waiting, suffering, and forgotten. And that is unacceptable. If you believe veterans deserve better than budget cuts and broken promises, don't just scroll past. Hit subscribe, share this video, and keep the pressure on. The more people see the truth, the harder it gets for leaders to hide behind excuses.